Hello and welcome everybody. I welcome you all to Happy Doctors Day celebrating the unsung heroes organized by Voice of Healthcare along with Manipal Hospitals. So this is our second year of celebrating World Doctors Day with Manipal Hospitals this year. And for this year, we are also doing a day-long event and series of panel discussions for our viewers, all on health awareness topics. So this panel discussion is on the topic of future of care, improving millions of lives through connected health. For this, we have some very eminent panelists here with us today. We have Dr. Satyanarayana Mysore, who is the HOD and consultant of pulmonology, lung transplant, and physician at Manipal Hospital, Old Airport Road. We have Dr. Abhijit Bhograj, who is consultant of endocrinology at Manipal Hospital, Hebbal. Welcome, sir.
Hi.
We have Dr. Avinash KM, who is the consultant of neuro and spine surgery and interventional neurosurgery at Manipal Hospital, Yashwantpur. Welcome, sir. We have Dr. Mohammad Rayan Saeed, who is consultant of cardio-thoracic and vascular surgery at Manipal Hospital, Yashwantpur. Welcome, sir.
Good afternoon.
With that, let us start with our discussion. So, as we are celebrating the unsung heroes, we have very generalized questions to all our panelists here with us today, all regarding public health awareness and sharing information regarding improving care through connected health. So, the main focus being how is millions of lives are improved with the integration of new and emerging technologies into healthcare. My first question would be to Dr. Abhijit Bhograj. Sir, please share some new health monitoring technologies that you are developing with Manipal Hospitals Hebbal and that will help millions of people in improving their health. Over to you, sir.
Yeah, thank you so much, madam. And it's a great honor to be here today and to be talking about the innovation that we are dealing with. So at Manipal Hospital Hebbal, along with Seven Sugar platform, we have developed a kind of a care delivery system which integrates continuous glucose monitoring sensors and looking at and using a mobile application, we get data which is coming in from these sensors. When dealing with diabetes, it kind of gets little complicated, and we need to get into the crux of the things. And usually, it's the lifestyle that is something that we don't monitor, and we become heavily dependent on medication. So, using platforms like information of what is happening with regard to these lifestyle related changes. So all the user has to do is take photographs of their food, continue to do their physical activity. They log in those aspects, and the sensor is collecting the glucose data. So when we get all these inputs of data put together, we are able to understand the user on a more personal level, and we are able to manage the diabetes in a much better fashion. And so that is how we are looking at advancing our care. It is with this information, it is with this analytics, we are able to deliver much more a better experience for the user, because we understand the user on a much more personal level.
Thank you, sir, for sharing all such knowledge. I am sure Manipal Hospitals Hebbal is doing great job in developing latest technologies. We would like to know from Dr. Avinash, present with us as well. Sir, can you please share some recent technologies in the management of stroke, as we see more and more people these days suffering from stroke from an early age, from 30 to 45 years of age. Please share how technologies and how you are helping patients in detecting these diseases. Over to you, sir.
Yeah. Thank you. Thank you very much for having me here. Now, like you mentioned, nowadays a lot of young patients are coming to the hospital with stroke. Now, when we say stroke, it's a broad term. There are many different types of strokes. Some can be blood clots in the brain. Some can be hemorrhagic. Any acute disruption, like either it is a bleeding or it is a blockage, could result in acute stroke. So, what is worrying factor is, a lot of young patients. Initially, we used to hardly see young people coming to the emergency department with stroke. Now, what is happening is almost like 3 to 4 out of 10. That's a huge number. Almost like 20 to 30% of the patients are young patients coming with acute stroke. Either it is bleeding or blood clots in the brain. So when these patients, there could be many reasons for having increased incidence of late. Mainly it is stress related. Diet habit, lack of exercises, and these are some of the could be many other environmental factors as well. Okay, so when these patients initially used to come to the hospital, about 5-10 years back, there was only one option available, which was giving an injection if the patient reaches the hospital within a specified period of time of onset of stroke. Okay, we used to give them injections, which in the common layman term we call it clot buster. So this injection, when given in right time, could open the blockages, okay, and re-establish the blood circulation. The chance of that working was anywhere between 30 to 40%, which means 3 to 4 out of 10 could be benefited by giving those medications. Now, with the advancement and technologies, we have a lot of newer interventional techniques. Like we have something called mechanical thrombectomies or something called aspiration of the clot. Okay, in cases of blood blockages, whereas in cases of blood ruptures or hemorrhages, we have something called aneurysmal coiling or stents, different types of stents or flow diverters, which would divert the blood flow away from the area of bleeding. So now, initially, like I mentioned, only 3 to 4 out of 10 could have been improved with the medications. Now, with these latest technologies, almost like 8 to 9 out of 10, we can re-establish the blood circulation and improve the quality and outcome of the patients. So these are some of the advances which are there in the field of stroke. Yeah.
Thank you so much, sir, for sharing such advancements. And we would like to know from Dr. Mohammad Rehan as well, what more advancements do you see happening in the field of cardiothoracic and vascular surgery in the coming years?
Good afternoon. Thank you very much for having me over. It's a pleasure to be here. Cardiac surgery and vascular surgery has grown by leaps and bounds. The direction in which we are heading is we're trying to make surgery as minimally invasive as possible. Those days of cutting the chest bone open and doing heroic open heart surgeries are slowly coming to an end. Most of the work is either being done through small keyholes, robots, and also with the help of a lot of catheter-based intervention. And we are actually going towards what we call as a hybrid cardiac surgery, which is a combination of the good part of open cardiac surgery and the good part of interventions. And that's where technology has been a big boon to us. The development of newer products, imaging technology is grown. And today we are able to integrate holograms, CT scans, MRIs, and echocardiograms into a single picture and deliver to the patient with absolute pinpoint accuracy what is required through very small incisions, like say 2 or 5 centimeter incisions, which was unheard of in the past. So I think technology development in cardiac surgery and vascular surgery has been enormous and in the best interest of patient care.
Thank you so much, Dr. Rehan. Now that we have the basics in place, our doctors shared with us what all latest interventions are being worked on. I am sure that, like everything else, with technology as well, there are also good things and bad things. There are pros of using one system, and there are cons of using technical advancements as well. So, what in your experience would you feel? And this is a common question to all our panelists. I will take one by one. So, can you please share with us what you feel still that, even with advanced technologies, we are still not able to be as successful, whether it may be something that we are lacking in, from the government side, or from in normal routine practice, or just technology is there as an added help, but there are certain factors that also need to be strengthened. So, starting from Dr. Avinash, sir, could you please share that in your field, what are the basic things that still need focus on, that from clinicians and from health authorities, that you feel that even when we have technology and everything, but without these things in place, the primary things, we would not be able to deliver as much success in our treatments. So over to you, sir.
Yeah, the main problem in the management of stroke is, first point is awareness. The second point is that not all hospitals have these latest technologies available. Okay, what is happening is many of these patients land up in smaller hospitals or local hospitals where even the treating faculties are not aware of these latest advancements which are there in the management. So what is happening is there is a delay in referring these patients to the appropriate hospital, and even if they reach in a time where the option for these interventions are over. So what is to be done is creating an awareness that such facilities are available. Second is also from the patients or the common men around, they should try to find out and see an hospital which has these facilities available, before like I'm not saying somebody will going to get a stroke or something, but as a common sense they should try to find out which hospital has what facilities, like in case of an emergency where they should land. And this could also be from the government side, that they standardize the hospitals or give a kind of a grading system to the hospital, that this kind of a grade has these kind of facilities in the hospital, that is made aware to multiple publications or advertisements, so that people come to know about what hospital has what kind of a facility. So if the patient reaches hospital in right time, we can definitely give a good care to the patients. And what I feel is that is the main drawback, lack of awareness and patients not reaching in time to the hospitals.
Very well expressed, sir. So even when we have, all the connected health facilities, all the, latest technologies with us, but if the patient is not being able to, reach the hospital or the doctor in time, definitely the treatment would get affected. And a very well important point that you shared, that we, heard in our previous panels today as well, that, standardization of the care all across India for private, for government, and allied health facilities is very much required, as you expressed as well. So, coming on to Dr. Abhijit, sir, what do you feel that even when we have technologies in place for improving the healthcare and everything, what are the other most essential things that are very much required or that need attention, so that we are able to use those technologies well and able to deliver, our treatments well to the patients? What would be your take on it? Sir, you are on mute.
Sorry. Yeah.
Yes.
So I kind of lost signal in between. So could you just repeat the question again,
Yes,
Ashwari?
I'll just repeat it. So, as we have seen that you are working with Manipal, Hebbal, with developing latest and greatest technologies. But what aspects do you feel still require equal attention? We could have all the technology in place, but if we do not have these primary steps taken care of, we won't be able to give or push out very great treatment. So what are those essential things that need to be focused at all times or need more attention?
So that's a very, very important question to be answered here. So the main problem, again, when you start bringing in new things for the patient engagement, or bringing in newer advances with regard to the testing, all of it has some amount of learning curve process for the user, as well as for the the person interpreting those that information that is coming in. So this is the the biggest gap that we start to see. So when you tell a patient to do something which is out of the ordinary or something new, if you are not educating them correctly why they need to be doing this, the new technology tests, or why we need to be engaging with this whole technology, then it becomes that is where the first problem is, if you don't educate them well. And the second challenge is, now for the doctors, very limited amount of time. Now when you start flooding the doctor with so much of information and so much of connectivity that we are having, it becomes a challenge because we only have limited amount of time. So there are good and bad aspects to it, but definitely more good. And the bad part of it is, there is if you call it, it is definitely a challenge, but not something that we can't deal with. So educating the patient to what is new, as well as educating the doctor, the end user, with how to interpret all of this and how to manage the teams that are in place, all of it makes a difference. So that is one aspect. Second aspect is, if it is too new for the user, if it is too complex for the user, then there is no engagement that would happen. So that is also something that people get scared because you're bringing out something new. So they really don't want to even start to venture into it. I would put that category probably about 4 to 5%. But again, by over time, once we start educating people why we are doing certain newer tests, why we are doing things in a certain way, then they begin to understand. So we all have to put in that kind of effort to educate everyone. So that is the most important aspect when it comes to dealing with the challenges of bringing in new technology.
Definitely, sir. Very well shared. And I feel like, with new technology, this challenge of trusting the technology or adapting it or responding to it is not just from the patient side, but from the clinician side as well. With the latest emerging technology and healthcare, companies pushing out, new and greatest technological tools for detection of one disease or the other, we are bombarded constantly with advancements into healthcare using technology. And for the clinicians as well to adapt to that, for the entire hospital to adapt to that, would also take the fair share of time and practice with that, so that they are able to deliver this. And we have also observed that this is not just a challenge in tier 1 cities, but it is a constant challenge in tier 2, tier 3, and rural parts of India as well. So, with that, I would like to have Dr. Rehan's opinion as well on the same. That in your field, what do you feel that regardless of the technological advancements, what are the other aspects that are equally important and should be laid more emphasis on to provide good care? Over to you, sir.
Yeah. So I would tend to agree with both Avinash and Abhijit on the fact that I think the first and foremost issue that we need to deal with is to create awareness of the disease and to create it in the right format. give the public what is actually they need to know in a very basic layman language, so that they at least don't make the error of sitting at home when they have a major issue. Just like stroke, even in heart attacks, there is a golden hour. We need to get to the hospital in that time. And time is muscle, we say. So, which means if you get delayed, you reach late, there is going to be a damage that you're going to be living with all your life. So, you need to get to the hospital in time, get a blood thinner injection or a clot buster, as Avinash was referring to, get that artery opened. So, at least you're safe and sound. And this today, at least, unlike the other specialties in cardiac, this is accomplishable at least even up to the tier 3 cities. So, educating general physicians in certain aspects of heart attacks and how they can save these patients and get them to reach the higher centers in a more stable fashion is one of them. The other thing, which is a big need, India being the diabetic capital, being the heart failure capital of the world, and we seeing a lot of patients with heart failure, is to create more and more awareness towards organ donation. It is the need of the hour. There are plenty of organs that are going waste, and this is something that we have to look at. People need to be aware that although as Indians culturally we believe that the our souls are, the heart is where our soul lies. It would be wonderful if we can leave our soul behind and give life to that many more people. Every organ donor gives life to almost 9 or 10 individuals. It's not one. It's plenty of individuals that are benefiting from this. I think the government is doing its job in trying to create awareness, but I think a lot more needs to be done. A lot more is possible to be done also. So I think if you take as a take-home message, I would say awareness that disease is here, and we are the world's capital of many of these diseases, and we need to be able to make sure that the lay public, irrespective of their affordability at any state of society, should be made aware based on their intellectual abilities about how to get good care, the right care, and in the right places. If they're stuck in the wrong hands, then that could also be a disaster.
Yeah, definitely, sir. That is some very one very important message that you shared today. That organ donation is just not beneficial for the future patients as well, but also when it comes to donating bodies to medical hospitals as well for educational purposes, that also goes a long way. So that is one different broad topic entirely, which we can discuss the benefits of with some other day. Let me come back to Dr. Abhijit. Sir, we know that Manipal Hospitals has collaborated with Fitbit and is working on new technologies that you are also a part of. Could you please share us regarding that? As Dr. Rehan already said that we are the diabetic capital of the world. So how are you working in endocrinal diseases and monitoring diabetes with this association that we've read about?
So the main project that I'm currently involved is with Seven Sugar, and so main aspect of what we are doing is using IoT sensors as well as home monitoring devices. So that is where the Fitbit part of it comes in. So by integrating these aspects, by collecting using multiple devices, we're now able to understand vital key metrics that we usually what we were doing in the OPD. Now we can do it at home on multiple interval basis. So once we set up now processes for this information to come in, there are teams who are overlooking this data. And so my diabetic educator team, my dietitian teams, they're on a daily basis, people who are at home who are part of our program, we get to see if they're within the range, if they're reporting certain symptoms. So immediately the teams get a report on a daily basis, and so they know exactly a group of, so we are able to monitor 15, 20 people at one shot. So in the morning, they get a report to see what are the variations that are happening with regard to the blood sugars, somebody reporting any new symptom. So, and then they bring it to my awareness. And so once this this process is set, and we're using the technology to correct the right information, we're able to improve care on a higher level. And it starts to become more real time, and it becomes convenient, and the engagement with the patient also is much better. And so they are happy because they want that kind of a link with the care provider. And when you are able to deliver it with information, with understanding what is going on, rather than simple phone call saying that, no, I'm feeling like this, here we have points of information to use and then action upon. Like if we are looking at somebody having high blood sugars, we know that this person is having high blood sugars, we know at which time of the day this thing is happening. And we are also looking at the food, that the eating pattern that they have, and then again we can start to make correlations. And then again we have the whole history on our CARE 21 systems, where we know the not only the history, we have the prescription. So you have all this information set into place, you have a team that is set into place. And that is how we're taking the help of these connected devices to deliver better care.
That is some very great and exciting information that you shared with us, that it would be easy for all the clinicians to monitor their patients very holistically, what they're eating, what they're feeling, and even other measurements which were by till now were just taken from the word of the mouth. That if the patient says that, yeah, I had 8 hours of sleep for the entire week, but we had no way of monitoring before the integration of this technology. So, with that, can you please share how these learnings can be applied to various hospitals all across India? Once if you are completed with this project, what all things can be adopted by different hospitals, so that we have a combined pool of data and pretty much all the patients are covered hypothetically.
So what this program allows us to do is, see, when look at an individual, and I'm using the use case of diabetes itself as of now, but it can definitely move on for somebody dealing with a simple infection. Now, when we are able to understand an individual, see, when they come to the hospital, the time spent with the doctor is anywhere between 5 to 15 minutes. So beyond that, that's it. Beyond that, we do not, and we have certain reports. Now, when you start engaging the patient with these connected technologies, so use cases where we are working with is like somebody getting somebody ready for a surgery. And Rehan sirs also and Avinash sirs, before their patients come in, they need to be at a certain level. So sometimes surgeries get postponed because their blood sugars are out of control, or the thyroid levels are not in range, or the blood pressure is out of sync. So they can't go in for these procedures. So here, once you are monitoring them, they come in for a pre-visit. So I'm now looking at a use case, which is somebody who's getting ready for surgery, but not because they have certain challenges. Such individuals, we can't admit them. Again, the cost of surgery, then their insurance coverage, all of it starts to come down. So when you're able to get the right information before the surgery, get them ready in a certain way, then it is helpful there. So we have done that for most of the departments. So quite a lot of for the orthopedics department, and even some people going in for cataract surgery. So these are not emergency procedures, but we still have time. But we need the person to be ready for the procedure. So that is from that aspect. Then during the hospital stay, we are again using live sensors to get patterns of blood glucose. And then once the patient gets discharged, they're again put on the program to collect the same information. So the whole care team is working through and through this whole journey. So with regard to the other hospitals, once we start different use cases, for example, for the nephro department, just tracking the BP and body weight, we are able to do a lot more, and symptoms. So we're not just looking at blood glucose. So using a kind of like a system in place, we're able to, with the right kind of parameters for each of the departments, what they want to be tracking, we're able to do that. So that is how we can we can probably bring the same process what we have developed in Hebbal to the other units, so that we can deliver the same kind of level of care and level of home monitoring, that is remote patient management. So that is also a new concept which is coming up. And so the patient doesn't need to be in the hospital environment for longer, just because we are just trying to track one parameter. By using such kind of things, we are able to discharge the patient early. We're getting the patient ready before surgery, again, without postponing anything that needs to be done. So all of these things are happening at our pace, at our control, with the information that we want.
Definitely, sir. So, as you've shared these information and these things, it seems to us that medicine is going to be very precise in the future. We would precisely be able to point out what was the reason that you were able to have this disease or this symptom, because we would have all the stats and all the things monitoring the information very precisely, different aspects of the symptoms. So that is one great news. Moving on to the same topic, to Dr. Avinash. Sir, as we see with technology and the advancements and people avidly using computers and and technology devices in their offices and at homes all the time, they are getting various diseases such as back pain or postural pains or neck pains, for example. Please guide us the best solutions to manage such back pains and postural pains, so that people who are spending time with such devices and technology also know how to take care of their health through this show. Over to you. Sir, you are on mute.
Oh, sorry. This is a real problem now. We are seeing a lot of patients coming with back pain, neck pain, scapular pain, purely because of postural, not maintaining a proper posture during their, working period. So also is the fact that, we are seeing a lot of young kids, between 10 to 20 coming with back pain, neck pain, which is predominantly probably related to the gadgets that they are using at home. What is happening is because of the posture in the working environment. What is happening is they are putting their muscles into acute stress, and that acute stress over a period of time becomes chronic stress and the pain. So to overcome that, what basically they need to do is to maintain the ergonomics, to have a proper working environment. I'll just give some 5 to 6 tips what they can do to counter these, work-related pain, back pain, neck pain, and these kind of things. So the first one is adequate distance between the computer and the person who is working. Now the question is, what is adequate distance? At least what you can, as a general rule, what you can keep is 1 arm distance. Okay, that should be an adequate distance to work on laptops or computers. The second point is keeping it at eye level. What is eye level now? Whether lower part of the computer, upper part of the computer, where should we keep it? You keep it your eye level at the upper part of your computer. Okay, so then what happens is you don't have to move your neck too much during your work period. Okay, the third point is your elbow should be at the level of the table on which your computer is sitting. In that case, what happens is your shoulder is not dragging. There is a support to the shoulder. You are lifting up your shoulder and there is no stress on the shoulder and scapular muscles. Okay. The fourth point is your posture should be anywhere between 90 to 110 degrees. Don't try to lean backwards at 140, 150 degrees. What happens again? Your back muscles will be under extreme stress. Over a period of time, there will be minor fractures or a fatigue that could lead to a chronic back pain, which is very difficult to treat. Even with medication, surgery, it becomes nearly impossible to treat those patients. Okay. The fifth point is your knee and ankle should be at 90 degrees. Okay, so don't stretch your leg and sit and work, or if you're shorter stature, if your leg is not reaching the ground, keep something below that so that your foot is on the ground or on the a table or a block of something on which it rests. Okay, these are some of the things that they can adjust in their working environment so that they don't get these kind of back pain and neck pain.
Thank you so much
And
for
also, I'm
sharing
sorry, I
all.
forgot
Yes,
to, yeah, I
yes, please.
forgot to tell. Then there is something called frequent breaks in between. If you're working for 8 to 10 hours, you cannot sit for a long period and work like that. The basic rule is 60 minutes, 60 seconds. Okay, if you work for 60 minutes, take 60 seconds at least minimum of break where you can do some small stretches and come back and work. Okay.
Thank you so much for sharing all these valuable tips. I'm sure as our viewers were watching you speak, they were adjusting their postures just like myself. We are all guilty as charged. And I feel like as we are progressing into the age of digital advancements, everybody is working from home mostly, and they have their home offices, and majority of the time are spent on technologies and on work desks. And making these small changes can do a long way in avoiding many long term problems, as you shared. So thank you so much for that. Moving on to Dr. Rehan next. Sir, I feel I want to ask you that from your perspective, we also have many digital advancements in cardiothoracic field. But apart from the currently available technologies, what all things would you require from technologies of the future in your field, and that it would really help you if there were technological advancements for certain things that you share with us? So I hope I'm clear.
Yeah, I'm just trying to put the answer together. So we'll start from at different levels. The first place where digital technology can come of use for us is, with all your social media and all your other kind of marketing platforms or awareness platforms, I think is to create awareness. That is A. B, then like what Abhijit and the team are doing is to see how you can get some kind of home monitoring, because that is an essential part even of post-op care for us. Patients need not be in hospitals, thereby also creating capacity for hospitals. You can't keep building hospitals to accommodate a population, but if you're able to build good rehab centers and good home monitoring setups, then I think it's game on. We can move patients to their home environment much faster than they should, that they can be at this point in time. We've already moved in one aspect, that is in the aspect of ICU care. We have a reasonably good ICU monitoring technology in place. You have digital ICUs. Philips is one of the pioneers in it. And I have been using this to handle my patients that I go abroad and operate, because we operate in countries like, say, Iraq or Syria or Nigeria. Once we finish the surgeries and when we return, we are able to monitor the care of these ICU patients in the ICUs and make sure that they are safe and they get home fine, because the healthcare there is still got long way to go to mature. That's the other part where digital technology comes of use. Then, like I mentioned in the earlier on, that technology and its development actually should be focused at making procedures easier and safer for patients, and head towards the direction of trying to get this done with the least invasiveness and with the least trauma to the patients in all aspects, and get them home with the same longevity of what traditional surgery or traditional medicine has offered till date. And lastly, nothing is more important for us clinicians than to assimilate our data, see whether what we are doing is right, see whether the new technology is actually heading in the right direction, We might say that it's right, but we may not necessarily always be right. But analyzing this data, pulling out the right inferences from that, and then working on trying to make it better, I think that's the way forward. And that's the way I think digital technology should play a role in healthcare. On the management side, it's already, you have enough of softwares that try to tell us how to squeeze the profitability, how to squeeze efficiency. And I think that's another different topic by itself.
Thank you so much for sharing, sir, all these valuable points. And I'm sure all the digital health technology people that are watching this show would have ample enough ideas to work on for improving the lives through connected health. So, with that, let us move on to the last segment, which is a common question for all the panelists. As today we are celebrating the future of care, we are celebrating Doctors' Day, and we are celebrating the unsung heroes who work day in and day out to improve the health of millions of people all over the world, doctors. So, what would your quick tip would be for all the patients and viewers watching to maintain good health? So, please share with us the three things according to you that are must for staying healthy. Let us start by Dr. Rehan.
Yeah, I think for me, the mantra would be sleep well, eat well, and play well. So you need to get 6 to 8 hours of sleep. That is mandatory. It doesn't matter how fit you are. If you don't get that much of sleep, you are a ticking time bomb and something can happen to you. And enough and more people, fit people, marathoners have dropped dead. And most of them, if you go back, the single thread seems to be very little sleep. Eat well is, I think, applies to all. I eat right, eat in moderations, and eat the right kind of food. And play well in the sense, make sure you get at least 30 to 40 minutes of moderate exercise on a daily basis, or if not, at least 4 to 5 days a week, and with a good amount of mobility, and even our very own yoga thrown in good quantity, so you can stay nimble, stay supple, and stay healthy.
Great, sir. Thank you so much. To Dr. Abhijit next. Sir, your three things, according to you, that are a must to stay healthy.
I think for all of us, it would be pretty much the same common thing: body, mind, and soul. I think if you don't take care of these aspects, uh, then as human beings, we have missed out on what is life. And so that is the most important, focus points. So assess these three focus points, and then if you're missing some component in any of these focus points, then work on that. So that is my simple mantra. So take care of your body, mind, and soul.
Thank you, sir. So, Dr. Avinash next. Yes. So, sir, our last question that we're asking everybody is please share with the audience the three things, according to you, that are a must to stay healthy.
Okay, three things should be eat right diet, and I'm sure you will find out what is right diet by various means. Second one is regular good sound sleep, minimum of 8 hours of sleep in a day, and maintain right posture. That should be the third one. Thank you.
Great, sir. Great. Thank you so much.
Thank you very much.
So, with that, we wrap up this session. And very rightly said, in today's generation of work, where productivity and working as much as possible is prioritized, taking care of your health and your body and giving yourself ample rest and play, as we shared, is also very important. So, thank you so much for all of you for joining for today's session. I'd like to thank all our doctors, Dr. Rehan, Dr. Avinash, Dr. Abhijit, for taking out valuable time for being with us. We will move on to the next segment, which is questions with Dr. Satyanarayana next.
Thank
you
you.
so much.
Thanks for having me. Thank you.
Thank you.
Thank you so much. Welcome to the show, sir. So, Dr. Satyanarayana Mysore, please tell us what is the expanding scope of pulmonology and pulmonary medicine at large with this day and age, and what advancements are there in this field also when it comes to lung transplants. Over to you, sir.
Thank you, madam. It is a privilege and an honor to be on your show. And happy Doctors' Day. Greetings to all the panelists and to all the doctors at large. I think we have seen the importance of doctors. We have seen the contributions of doctors and nurses, all healthcare workers in one bracket during the COVID pandemic. And it should make everybody proud that we have good doctors in our society. That is point one. Point two, also matter of pride that our mortality rate was much better than the Western world when it came to COVID. And we have managed the pandemic very well. It is not, when I say we, it's not doctors alone. I think the country as a whole has managed the pandemic very well. On that note, I will take your question. The point is, I would like to look back on pulmonology, say about 20 years ago or 30 years ago. Pulmonology just meant treating chest diseases like tuberculosis. And tuberculosis, the prevalence and incidence was very high, and that is what it was. Much water has flown across the bridge since the last 20 years. There is fantastic developments in the world of pulmonology, bringing succor and relief to lakhs and crores of patients. Point number one, we have interventions. We have from a simple bronchoscopy to rigid bronchoscopy to electrocautery to EBUS, which is endobronchial ultrasound, avoiding surgeries like mediastinoscopy by doing this technique. So much, very much realm of improvement is seen in pulmonology. Number one. Number two, pulmonology has dwelled into critical care, and there is a lot more understanding of pulmonology scope in terms of metabolism, in terms of critical care, in terms of intervention, imaging, procedural aspects. When we look back 30 years ago, number of diseases were more of infectious diseases, and non-communicable diseases was a very small segment in the healthcare. In today's world, it is more of non-communicable diseases, that is the lung parenchymal disease, the pulmonary blood flow related disease, that is vascular disease, pleural disease or fluid accumulation, the covering of the lung between the lung and the chest. These kind of diseases, lot more diseases have been unearthed due to imaging developments. So in a nutshell, lot more diseases that were existing, we know more about them. Newer medications are there. Early diagnosis of lung cancer is possible in most extent. And much more than anything, lung transplant was always an enigma. How can India afford lung transplant? How can lung transplant be a success story in India? Now that myth is dispelled. Lots and lots of heart, lung and lung transplants are happening in our country. I think with respect to healthcare developments, pulmonology has not stayed back. Thank you.
Amazingly expressed, sir. And some very nice interventions and new things that you shared with us today. So, my next question to you is, we see this branch of sleep medicine expanding at such a great extent these days due to, the new technologies coming into this field. Can you please touch upon that and also bring sleep apnea and related diseases into the picture? Over to you, sir.
Yes, this is another thing that has stood and changed with the times. If we were to look back 40 years ago, people who snore were usually very affluent and powerful people. The village sarpanch or the head man of the village or very rich people would have the afternoon food and then later have some snoring. So snoring was more synonymous with the sleep with affluence then. But now, lots and lots of developments with respect to sleep medicine. People have found what is sleep apnea. They can describe, they can diagnose sleep apnea. Home sleep studies are in vogue. Level 1 to level 4 sleep studies are there. Lots of development with respect to what sleep apnea can lead to, how can we prevent it, how can heart problems, heart rhythm problems, metabolic problems can all be linked to untreated sleep apnea. How can we prevent that? So snoring is the new poison. Like what we used to say, sugar is the new poison. Snoring is the new poison in the current times. And we have solutions for that. Apart from that, as you would agree with me, people made a lot of interpretations about the dream. And lot of psychological trauma issues led to dream related disorder, no loss of muscle tone during dream, REM behavior disorder, parasomnias, that is those kind of behaviors that are seen like sleepwalking, sleep talking, and huge number of issues that prevent the individual from getting into sleep, starting with mental health issues, depression, and restless leg syndrome. So many of the systemic diseases that can upset sleep onset. Equally so, diseases that lead to increased sleepiness, changing time, changing society values have changed, job descriptions, work from home, work from new planet. So that has led to disturbances in the circadian rhythm. So there is a huge new science about circadian rhythm disorder, from simple jet lag to shift worker to proper advanced sleep phase syndrome. So huge number of changes in the sleep medicine area, and it is good enough to stand out as a specialty on its own.
Thank you so much, sir, for sharing such interesting facts in the end. And definitely, we would love to hear more on these, specifically at a separate show altogether, maybe in future. So, coming on to the very end, this is one question we are asking on this Doctor's Day to all our guest panelists. As we are celebrating Doctor's Day today, we are celebrating the unsung heroes that keep the nation healthy. Please share with the audience those three things, according to you, that are a must for staying healthy.
First thing, since it is Doctor's Day, I would like to call upon our colleagues and the doctors and healthcare professionals at large to remain healthy, be a role model, and set an example for your patients and the society at large. Having said that, mental health peace of mind becomes the most important number one priority in the testing times that we live in. And one way is for doctors to look after their health and have some peace of mind is to get the buy-in from our patient groups. We need to establish the glorious past values of the medical profession, win the trust of the patients. And to patients, I would say this: no doctor would want a patient not to recover. Every doctor wants to find a cure for his patient. Therefore, let us work on building the trust. If there is a trust deficit, that will lead to anxiety, lot of misbelief, disbelief between the healthcare provider and the patient at large. So I think the number one priority is to build trust, and for that, we as doctors, we need to work very harder. We need to have uniform practice patterns and work in such a way that patients do trust and believe, and we need to have a sense of transparency. That is point number one. Point number two: we can remain healthy, and so can our patients, by doctors focusing on patient support groups, smoking cessation, substance de-addiction, and all this, and treatment of chronic lung diseases or chronic ailments, whether metabolic or lung or heart. We need to create patient support groups that will provide a vehicle for information to not properly informed patients, to provide support, provide a hand-holding support, and this can be done pro bono and as a written gift to the society. For society has made us doctors, and we need to give something back to the society and establish health bonds on either side of the bridge. Third, but not the least, this era and time that we live in, we are facing huge array of metabolic issues. Food is in abundance. Fast foods are in excessive availabilities. Therefore, we need to look and watch out what we eat, how much to eat, and what kind of exercise we need to adopt based on our individual health requirement. Therefore, to build a strong and healthy nation, we need to, all of us, focus on diet and exercise. Thank you, madam, for this opportunity. Jai Hind.
So greatly expressed, sir. And definitely, I feel through this medium, our audience would also pay attention and would appreciate and celebrate doctors at the same time. Thank you so much, Dr. Satyanarayana Mysore, Dr. Abhijit Bhograj, Dr. Avinash KM, and Dr. Mohammad Rehan Saeed for taking out time from your busy schedule and for being with us for this discussion. I wish everybody a very happy Doctor's Day, and I hope you all are taking care not just of yourselves but also doctors of your society. With that, we wrap up this super interesting session.
Thank you,
Stay
madam.
tuned and keep watching. Thank you.